Right. Give everyone a few minutes to join. Welcome, everyone. We'll get started here shortly. Just giving everyone a few more minutes to join. And we'll get going. Okay, so why don't we go ahead and get started. I want to welcome everyone to our third learning session on equipment, supplies, and medications. Begin with our acknowledgement and disclaimer. The Emergency Medical Services for Children Innovation and Improvement Center is supported by the Health Resources and Services Administration, HRSA, of the U.S. Department of Health and Human Services. This partner award, this following number, totaling $3 million, was 0% financed from non-governmental sources. The contents are those of the authors and do not necessarily represent the official views of, nor an endorsement by HRSA, HHS, or the US government. So for more information, please visit hrsa.gov. And as a reminder, the session is being recorded and a recording will be posted to the website. Also, as part of our CE, we want to give a disclosure to our learners that the criteria for successful completion in order to receive CE credit is to attend the live session and then complete the evaluation after the session today. So you should have received from me the session evaluation this morning so that it's at the top of your inbox. And I apologize for any confusion I may have created by sending that to you early. I know a couple were confused that maybe we'd missed the webinar, but I just wanted to make sure you had it so you could complete it as soon as the webinar was over today. And most importantly, the planners and presenters of this course have no conflicts of interest to disclose. So we want to hear your thoughts throughout the call today. And so whenever you see this icon, we'd like you to place your thoughts, ideas, or experiences in the chat box or ask a question for the Q&A feature. Also, those Spanish subtitles that you are seeing at the bottom of your screen is not your computer deciding to do its own thing. It's a setting I have on mine because we have some Spanish speakers that are joining our call. So let's jump in. So quick agenda for today, give kind of a quick overview of the collaborative in general and review what our goals are and what we're trying to achieve here with this collaborative. And then I will hand it over to our speakers for today, who will give a little bit of background on the subject and walk you through the key drivers and change strategies on really how to improve here. Talk about how to begin, how to work through the process map, how to create an aim statement, and then you'll hear from me again on a few housekeeping items and reminders before we go into the breakout sessions for the second hour. So before we jump into today's topic of pediatric equipment, supplies, and medication, I wanted to kind of take a moment to revisit the intention of this collaborative and review how we really plan to get where we're going. So the goal of this collaborative is really to help you become a highly effective pediatric emergency care coordinator, a PEC, or a pediatric champion through a better understanding of systems design and quality improvement methodology. So to put that in more straightforward terms, that means that we're not trying to just show you what the essential elements of pediatric readiness are. There's a checklist for that, and you could download the pre-hospital or ED checklist from our website and simply just check off the items and find the items you don't. What we're trying to do here is build an understanding of how there are characteristics of the systems in which we work, whether that's at the unit level, the department level, or entire agency or hospital system, that really contribute to how effectively we can improve the quality of care that pediatric patients receive. And so really with that understanding of the way in which the entire system can contribute to your improvement efforts, we can then utilize quality improvement methodology to really increase the quality of care. And so how are we going to get there? First and foremost is confidence. So our primary goal is to really foster confidence in you all with truly understanding the ways in which this role can be defined and help you and feel confident in really embodying that role. And then to support you, we'll teach you the fundamentals of quality improvement methodology, and we'll outline the framework and the tools. And then in part 2, we'll coach you through for what many of you will be the first attempt at using QI methodology to drive improvement in pediatrics. So here's kind of what that looks like if we look at it as an overview. So here's what we're doing in phase 1. So we're really kind of looking at each focus area, understanding the importance of the focus area as it relates to pediatric readiness, and then sort of examining the system level processes and the key drivers that really affect each, and exploring possible change strategies that drive improvement. And then you'll get to see in the breakout sessions an example of how this really works and how others around the country are doing this. And then in phase 2, it's your turn. And that's where you will have the option to really select an improvement project, develop a SMART aim, build a team, choose a change strategy, and work through an implementation plan, all with coaching from us and your peers on how to really best do this. So as we come back to today's focus on equipment, supplies, and medication, our intention is really to illustrate the role of equipment, supplies, and medications in pediatric readiness, but also to examine the system level processes that influence improvement in this area. And appreciate how how this focus area relates to other aspects of pediatric readiness. I think it'll be really clear that you'll immediately think of one of our next focus areas, which is care team competencies, as they tend to go pretty hand in hand. And then we're going to illustrate the framework for QI and how it really relates to equipment, supplies, and medication. And I'll give you a quick clue. It's more than just buying a Braslo cart. So there's going to be a lot more to it that we're going to walk you through as far as drivers. So what I want you to do today, I want you to think on focus on the process as we go through today. Think about the process as how to improve, and use the stories we share and the examples as rather just prior examples and not solutions or what you necessarily have to do or should be doing at your agency or your ED. And remember that QI is a journey, so there will always be opportunities for improvement. And really what I want you to think about today as we talk about some of these elements is what opportunities for improvement can you identify at your organization? So let's jump in. Our purpose statement, to kind of review what we're doing here, is to ensure that emergency care staff have ready and easy access to safe and reliable pediatric equipment, supplies, and medications when needed. So today's focus is really about the location, understanding how to access and use these pediatric equipment, supplies, and medication, and not necessarily staff competencies around that. So that'll be later. And I want to jump in, begin our exploration of this focus area with Zach's story. And I want to introduce Julie. So Julie Johnston has been an active member of Louisiana AMSC Fan Group, or our Family Advisory Network, since 2014. So she serves as the program manager for the Louisiana Department of Health Birth Defect Surveillance Program in the Office of Public Health's Bureau of Family Health. But if that wasn't enough, Julie is also a mom to Zach. Zach is 28 years old now. He's a really cool guy that thrives despite his medical complexity and developmental issues. And she's going to share a story of what happened to Zach when he was a little guy. And so with that, I'm going to turn it over to Julie.
Good afternoon, everyone. Thank you for having me share my story today. So Zach was born with spina bifida, hydrocephalus, and a bunch of other stuff. The list is long, but he still has a lot of urology issues. So he was 2 years old. He had a UTI. We had been dealing with this at home, and I had given him an injection of Rocephin, and immediately he went anaphylactic. He just like exploded, because he had a propensity for anaphylaxis already, a severe latex allergy and other allergies. We had epinephrine. And back in the day, for little ones, you had to draw that up. It wasn't in an EpiPen for his size and weight. So I did that. I gave IM Benadryl, and we scooped him up and went to the nearest ED, which was not a pediatric affiliated with a pediatric hospital. So I drove to the ambulance bay. My husband jumped out with him in his arms, and the security guard stopped him and said, "You can't go in there." And in honor of Veterans Day and yesterday, the Marine Corps birthday, my husband was a Marine. And so he just kicked the door open and went into the ED and said, he has anaphylaxis. And so, that kicked the ant nest. And, you know, looking back and unfairness to everyone there, but they jumped into action. But that hospital was not PEDS ready. So they could not intubate him. He didn't have a pulse when we arrived. And, he was dusky and just swollen. And he was already a squishy baby, as you could see. This is his 2-year-old picture, and this was a little bit younger. So on top of all of that, he had vascular malformation. So he wasn't an easy stick to start with. And so not only did they couldn't intubate, um, they had a really hard time getting access, and they were not successful. So they did a IO. Um, and of course called, the pediatric hospital transport team came. And when they arrived, they intubated him um, before transporting him to our pediatric hospital, to the PICU. So in all fairness to that hospital, I have to say, that was 26 years ago. And, those folks, they wanted to help, right? But they didn't have the equipment. Their latex-free crash cart had not been restocked. It was, had been pilfered and used, and it wasn't stocked. They didn't have PEDS sized intubation equipment, and they didn't have pediatric size IV supplies. Zach is still has bad veins, really teeny tiny. So he still uses, as a 28-year-old, pediatric size IV supply. So, um, that was our first experience outside of our children's hospital. And it was a hard experience. Um, but those providers at that hospital got ready after that. Thankfully, he survived, and we got to our pediatric facility where they took care of him. Um, but we had a number of occasions to go back to that hospital in the same situation with anaphylaxis for one thing or the other. And they were ready for us after that. Um, so that's my story. If there had been a PEC, that crash cart would have been stocked. Those supplies would have been available, and providers would have had skills competencies to respond and take care of him. So that's my story.
Thank you, Julie. I think, even though it was so long ago, it's still a very powerful story, and something that could certainly still happen today. And thank goodness for Marines. My husband was a Marine too. Happy Veterans Day to all you out there. Any comments or questions for Julie before I kind of introduce our speakers for today, and we can reflect a little bit on Julie's story as it relates to pediatrics, equipment, supplies, and medication. And once again, you don't have audio or video, but you can use the chat or Q&A box. Okay, well, we'll keep on monitoring on it, and there'll be some more time at the end too if you'd like to ask Julie any more questions. Thank you, Julie. So our speakers for today are Rachel Alter. So Rachel is the co-lead for our pre-hospital pediatric readiness project. She's also the co-lead for the EIC state partnership in pre-hospital domains, and also a program manager for the National Association of Stadium MS Officials, or NASEMSO. And Lisa Gray is a co-lead for both our hospital and trauma domains. She has a background in trauma nursing and had joined the EIC about a year ago. So with that, I will turn it over to Lisa and Rachel.
Thank you very much, Rachel. Good morning or good afternoon. Oops. Thank you very much, Meredith. Good morning or good afternoon from wherever you are today, depending on where you are in the country today. So happy to have you here. So Rachel and I are going to talk a little bit about equipment, supplies, and medications today. I'll start with thanking Julie for providing or sharing her story, her and Zach's story, your family's story. And unfortunately, I think this probably still happens in our country today, every day. So we're going to try. We're doing our best, all of us on this call, to prevent circumstances like this from. Unfortunately, we know that it sometimes takes a near miss or a bad event to make change, to be PEDS ready. I think I've seen a couple of you in the chat box already acknowledge that. So we want to be prepared in advance so we don't have to have one of those bad events or bad circumstances be the precursor to what makes us PEDS ready. I'm trying to, there we go, sorry, oops, too fast, sorry. All right, so let's start with some very important considerations and a little background. On a little lighter note from Zach's story, how many of you have seen or been in a similar situation as the one you see on your screen with one of your patients? We'll just make this adult size mask work. Nope, that's not acceptable. Providing quality care for children follows the same principles as we provide quality care for an adult. We know that children are not little adults and have different physiologic responses to trauma and illness compared to their adult counterparts. Learning how to effectively recognize, assess symptoms, and perform interventions can improve the healthcare provider's ability to respond more confidently. Think about how ready you are in a situation like Zach's. When you don't have what you need, you're not confident in your skills and ability to provide the best care possible for kids. We can't provide excellent quality care for children if we don't have the appropriate sized equipment, supplies, and medications readily available and accessible. Only 10% of pre-hospital calls are for PEDS patients. Similarly, only 20% of ED visits across the country are pediatric patients. Therefore, the majority of patients are adults. We know this. But let's think about the variability in the size of equipment for that small little number of kids. The wide ranges of ages and body sizes within the pediatric population requires advanced preparation to ensure that there will be appropriately sized equipment, supplies, and acceptable medication formulations to support the care of young people of all ages. If we don't focus considerable effort on that variability, we won't be successful in providing good care to kids. We will learn more about competency and training in a future module, but I think it's important to acknowledge here that the healthcare practitioners working in both small community and rural settings face a unique challenge in maintaining competency in low volume, high risk procedures, again reinforcing the importance of having appropriate sized equipment, supplies, and medication at their fingertips. The groundwork to emphasize the importance of stocking equipment, supplies, and medications for PEDS patients was laid in the 1993 Institute of Medicine, now called the National Academy of Medicine, Emergency Medicine for Children report. This report recognized that appropriate tools are needed to enable emergency care providers to use their training and skills successfully. The report further recommends that all hospital EDs and EMS systems maintain a minimal level of essential equipment and that consistency in these requirements is appropriately balanced with the flexibility needed in special circumstances. If these materials are used infrequently, they must be monitored on a regular basis so they do not deteriorate or become outdated. In today's learning session, we are going to give you a solid foundation on how to do just that in your role as a PEC. Looking at some data here, we know that past assessments of both EMS agencies and EDs have shown that over 90% of those surveyed stock nationally recommended pediatric equipment, supplies, and medications, which seems pretty good, right? And it is very good. But our work is to ensure that we are always PEDS ready and that it doesn't stop at just stocking the equipment and checking the list. The intent of this focus area is to help you create processes to ensure individuals involved in patient care know where and how to access well-functioning, age-appropriate equipment, supplies, and medications at all times. This includes organization of supplies and equipment, staff awareness of where things are located, putting processes in place to report issues or errors with any of the supplies, medications, and equipment, and perhaps even coordinating with families of children with special health care needs to ensure that you are always prepared when they come in. These are just a few examples of what we will cover in today's learning session. So why does it matter? Let's talk a little bit about the Institute of Medicine's domains of quality for a minute. 6 domains of quality exist within the healthcare system: safety, effectiveness, person-centered care, timeliness, equity, and efficiency. When thinking about your quality improvement projects, one should seek to improve the patient experience in at least one of these domains. Each of these areas of domains of quality can easily be interconnected with the work around equipment, supplies, and medications. Quality improvement in healthcare is an ongoing process and certainly doesn't happen overnight. QI applies to every step of the healthcare process. We know that in healthcare, everything is connected. When you improve one aspect, it applies to all others. Sorry, I'm having trouble advancing. All of a sudden.
Is it working? You may do it. I can do it.
There we go. There we go. Quality improvement means a focus on activities to improve performance above minimum standards and reasonably accepted levels of performance, quality, and practice. Today, we will discuss key drivers and change strategies related to procurement of supplies, maintaining up-to-date and complete inventory, organization of supplies, collaborating with other organizations to lessen the burden and cost of supplies, equipment, and medication, orienting of staff to access supplies, and evaluating, selecting, and updating supplies, equipment, and medications that you may need. When we speak of key drivers, we focus on those aspects of your work environment that help you achieve an aim to ensure appropriate equipment, supplies, and medication are readily available within your organization. Today, the key drivers Rachel and I will discuss are funding, communication, policies and procedures, resources and tools, technology, and education. Let's take a look now at specific things that will drive success in our improvement efforts within our pediatric emergency care delivery systems. Take a look at this template of a key driver diagram. We will use this structure as we move through each of the key drivers I just mentioned today. A driver diagram is a visual display of a team's theory of what drives or contributes to achievement of a project aim. This clear picture of a team's shared view is a useful tool for communicating to a range of stakeholders where a team is testing and working. A driver diagram shows the relationship between the overall aim of the project, you can see in yellow, and the primary drivers, also called key drivers, that contribute directly to achieving the aim, the secondary drivers, and specific change ideas to test for each secondary driver. Key drivers are the most important influencers on the aim, and you will have only a few. We recommend 2 to 5. Secondary drivers are influencers on or subsections of the primary drivers, and you may have many. As you identify each driver, think about establishing a way to measure it. So let's start with funding. Funding for equipment, supplies, and medication. Remember that the purpose of this review isn't that you implement all of these changes for your organization or agency, but determining what starting point for your system makes sense and that could be easily attainable. So we'll start with funding. You'll see on your screen at the top of the green box, I've kind of defined what each section means. So what needs to be done to meet your aim? So funding, how can we get appropriate funding in our organization or agency to ensure that we have supplies, equipment, and medication at all times? The blue box are our secondary drivers, or how are we going to make that happen? Through cost reduction strategies and grants. How can we be cost efficient, and how can we maybe obtain these goods, services through grants or other opportunities? And here are some change ideas. Again, just examples. So engage in shared purchasing models with your hospital in your region or network. We have many hospital systems throughout the country now. Perhaps you have the sister organization or the hub organization that you can engage in shared purchasing models with those entities. Equipment exchange agreements with hospital or agencies. Again, thinking about the purpose of these. We don't want expired equipment to just that, expire. How can we move that equipment through our system or agency to where it will be used someplace more quickly before it expires, and reducing the costs at our own organization if we don't use that equipment in time or that supply in time. When we think about grants, we think about reaching out to foundations, academic institutions, professional organizations or societies, and research projects as well. I can think of a specific example. We reached out to, in my hospital, our NICU team was in need of some supplies for their isolate transport, their transport isolate. So they reached out to the foundation and were funded those funds for that particular purpose, especially if you have robust foundations in your organization or in your community. Always something to think about. All right, moving on to communication. Who do we need to communicate to the importance of equipment, supplies, and education? So when I think of who we need to talk to, who do we need to get in front of? We have 2 buckets there. Our leadership and then our coworkers, staff buy-in. How can we get leadership support, and how can we get our coworkers on board with these initiatives? So that can look a few different ways, some change strategies to think about. So for our leadership team, we know that we can very frequently use talking points around the importance of having equipment, supplies, and medications to deliver high quality, effective, safe care. Use a Sentinel event when you didn't have, for example, Zach's story. Use a Sentinel event in your organization to take to your leadership and say, here's what happens when we don't have what we need. I think it's also, you can communicate to your leadership the importance of pediatric recognition programs in your region or your state that maybe would get some leadership buy-in. Hey, we're pediatric recognized now in our state's program. This also means that we must have the proper equipment, supplies, and medications available at all times. When we think about staff and our coworkers, talking again about safety events and how to prevent safety events if we have the appropriate supplies, equipment, medication. And just talking points all around, talking points in general, to both leadership and your coworkers and staff to get buy-in for having what you need at your fingertips. Key driver 3 for equipment, supplies, and medications is around policies and procedures. What policies and procedures do we have to have in place to ensure that we have what we need at all times? So we need to develop processes for tracking and replacing supplies. We need to have a policy for standard daily checks of equipment. Is our Braslow cart or our crash cart being checked daily? Is there a policy that supports that? So folks know that it must be done at each shift or handoff or whenever that must take place. We have to have a policy and procedure for that to happen. And then also a policy and procedure for evaluating new equipment, introducing new equipment, or retiring equipment as well. These are, again, just a few examples of the many that can happen. So creating policies for checking equipment and medications, identifying methods for restocking missing and expired items, who's in charge of that, who's responsible, identifying individuals, like I just mentioned, developing a process to regularly verify expiration dates and functionality, and then also developing an equipment committee review, excuse me, recruiting your coworkers to participate in equipment review committees, so on and so forth, to ensure that everything you need, pediatric specific, is available at all times. And now I'm going to turn it over to Rachel, who will talk about resources and tools.
All right, thanks so much, Lisa. So this driver focuses on those resources and tools that you may need to achieve your specific aim. Okay, let's see if we can get this to listen to me now. Meredith, I might need you to do it. My keyboard isn't. Thank you.
I gotcha. Just let me know.
Okay, thanks. All right, so our secondary drivers for resources and tools could include things like reminder cards, a locator map and list for pediatric supplies that might not be stocked in your pediatric cart or jump kit, drug references and formularies, and color-coded weight-based systems. Next slide, Meredith, please.
Sorry, it's coming now.
Thanks. So with these change strategies, you'll notice that the first two actually correspond with two of the secondary drivers. So, oh geez, I'm sorry. The first one relates to just the first driver. So reminders could be posted to help you remember to restock those equipment, supplies, or medications between patient encounters. More specifically, you could have a resuscitation packet that includes this reminder on the bottom of the packet. So in locator maps, you could create a checklist that includes it includes the checklist for supplies that aren't stocked in the pediatric bag or cart. Your drug reference card should be readily available and could be included as a binder or reference card. As it relates to color-coded and weight-based systems in emergency departments, you could create that pediatric cart for quick and easy access to pediatric-sized equipment, supplies, and medications. For EMS agencies, having a pediatric bag prepared for quick and easy access to all of those supplies, equipment, and medications. And ensuring for both EMS agencies and emergency departments that you have that length-based tape available and accessible to all staff, and considerations of replicating the same system throughout the organization, so you're not accessing different different systems depending on where you're at. And key driver 5 is focused on technology and how that can help mistake-proof your system and avoid unnecessary expenses. So technology can help you with automated tracking and alerts for restocking, expiration dates, and tracking equipment failures and daily equipment checks. And thinking about your change strategies, those automated supply tracking for restocking could include something like a radio frequency identification, or RFID, which is a tag attached to items. And once something is used, it's off the system and helps reduce the need for manual inventory management and providing a real-time update to supply levels. Other systems could include scanning of items when they are removed from supply. You could identify a system to log and track equipment failures, or identify a separate system that helps automate alerts for when you have equipments or supplies that are low or nearing their expiration date. And combination of these systems could help you also manage your supply stock so that items that are potentially becoming expired would be the ones you grab first, rather than something that might have an expiration date that's further into the future. And lastly, you could use an electronic checklist to help you with those daily equipment checks that Lisa discussed in a previous slide. Our next key driver is focused on education. So this is not about competency, but rather about whether staff are knowledgeable on the processes related to equipment, supplies, and medication, and the location of those items. So how do you get there? You can think in terms of how new staff are oriented. Are the equipment policies and procedures part of your new hire orientation? And also, are current staff trained on that during any annual competency trainings? Do you have a policy in place for just-in-time trainings for handling of new equipment, supplies, or medications that are being stocked? And are your partner organizations involved in any sort of cross-training or simulations that you have? In thinking about change strategies, this is one where you can see some linkages to various secondary drivers. So you could design a scavenger hunt that could be used in both new staff orientation and your annual trainings. You can evaluate both the new staff and current staff on location of those supplies. Some ideas could be doing this pre-shift scavenger hunts, or identifying gaps during safety huddles. For just-in-time training, just thinking about how you would handle that for when new equipment or supplies are identified and stocked. And thinking about team simulations and integrating usage of pediatric specific supplies during team simulations, and if possible, integrating your partners in EMS to include ALS and BLS, your air medical providers, and emergency department staff, so that everybody understands what each section of the system is working with. So I know this was a lot of information to go through, and I hope it wasn't too overwhelming as we reviewed the key drivers, but we were hoping that having this visual would help you kind of see the steps that are used while thinking about your change strategies and what's affected by all of those. So how do we begin? We're going to take a look at how to kind of start this improvement program, and recognize that all the steps I'm about to review don't necessarily have to come in the order I'm presenting them, but they're all very important steps to think about as you walk through this process. So here's the process flow map that you should recognize from your focus area guide that was provided to you a couple weeks ago. So as I walk through this, think about what step you might be on within your own organization. So this is intended to help you organize your work and determine where you are and where you need to go. So consider that if you art, if you don't have the first step in place, then it doesn't make sense to work on the last one. So in this particular example, if you don't have that equipment list that aligns with national standards, you'd want that to be your first aim and goal, rather than working on the mechanism to evaluate and implement new equipment and supply changes when needed. So walking through this really quickly, that first step is looking at whether or not you have a required equipment list that aligns with those national standards. If not, that's where you would start looking at what change strategies could get you to have that in place. If you do have that, you could look at whether or not there are mechanisms in place to ensure your agency or ED actually has those listed supplies, equipment, and medications in stock. When you have that in place, you can then move on to whether or not the staff are trained on the location of all of that equipment, supplies, and medications. And from there, you can move on to whether or not there's a mechanism in place to monitor, track equipment, supply, medication needs. And lastly, when that's in place, you can look at how to evaluate, introduce, and implement equipment, supply, and medication changes when needed. All right, so next slide. Thank you, Meredith. So this is just a quick review that we also have that environmental scan included in your focus area guide. Again, this is just a tool to help you, help guide you to determine where your organization is in the process flow map. And that will help you key in on what your aim statement could be if you choose to focus on something related to equipment, supplies, and medications. So for those of you who filled out the environmental scan, were you surprised by any of the gaps identified? We'll just pause here for a moment to see if anybody drops anything in the chat. And it could be that you haven't gotten there yet, which is fine. All right, I'm not seeing any comments, but this is just something to think about as you work through these processes. All right, so now we're gonna just take a real quick look at an aim statement example. So once you've gone through that environmental scan and reviewed the process map, this is where you determine where your ED or agency needs are, where you can improve, and how you create your aim statement. So as reviewed in past learning sessions, you need to try and keep your aim statement as a SMART goal. So thinking about it being specific, measurable, achievable, relevant, and time-bound. We've listed here a couple examples of aim statements. I won't read them to you, but these kind of deal with the national guidelines and staff being trained on the location of that equipment. Further aims could be focused on that concept of rechecking the equipment, checking for expiration dates and such, and that restocking of equipment. So just a few things to think about as you work through what your aim statement could be. So next, you might want to think about building your team. So your team size could depend on both your organization structure and the project you're working on. You think about what skills are needed to support your project goals, what key staff should be involved to support that project, and who is most impacted by the project. So when thinking about building this team, consider using a stakeholder grid to help you determine these key players. So you need someone on the team that actually has that power to help implement that change, and who has the biggest investment in the change. For example, if you don't have buy-in from your colleagues, they might not adhere to that policy change. So it's important to keep them involved in this process as well. And using this framework could help encourage teamwork necessary to implement that change. So as this example here, if your aim is that by March 31st, 2020, you'll have an approved policy that aligns with national guidelines, a team could be comprised of your organization's leadership, your medical director, and an education coordinator. All right, so moving on to implementing changes. And before you start implementing changes, of course, you need to identify those drivers and change strategies like we reviewed in those previous slides. And that takes us to kind of this, back to this key driver diagram concept. And using the first step in our process map, your aim statement again could be by March 31st, 2022, we will have an approved policy that aligns with national guidelines. So this SMART aim drives that quality improvement and change strategies. So in this example, your key drivers could include communication, policy development, and resources. And here, obviously, we've got the rest of this key driver diagram blank, as this is simply an example that, depending on the time in your next breakout session, you might fill this out. Moderator might help you kind of think through this process. So this is just a teaser for you to start thinking about things that you could do to help drive this aim. All right, next slide. Thanks. So just really quickly thinking about measurement, we're not going to dive really deeply into this at this point, just a quick review that measurement is how you show your improvement, and you can't change what you can't measure, which makes that SMART goal so much more, it makes that important to think about that as you work through your SMART goal. And some is not a number and soon is not a time. So again, you might have time in your break session to dive a little bit deeper into how you might work on measuring your change strategies. All right, so quickly in summary, in thinking about the steps that I just reviewed, recognize that this is not a one-size-fits-all formula, and forming a team is a really important component, but depending on your structure, it could be your first, second, or third step. So while this learning session was specific to equipment, supplies, and medications, the improvement project you choose for phase 2 of this collaborative could be related to any of the topics we covered during these monthly learning sessions. And the steps we've reviewed today about key drivers and change strategies, that's the important takeaway point, and that the change statement or change strategies are all going to depend on your project aim and statement, but the process will be the same depending on what you do. All right, so just a reminder, oh, sorry, I think maybe my keyboard started working, sorry, Meredith. We do have a resources section available to you on the website. So the QR code takes you to this resources section. It does show your flow diagram and some key drivers and change strategies, along with some templates and resources that you could use to help you move forward. And just our inspirational quote for the day: success is the sum of small efforts repeated day in and day out. And with that, I'll just pause really briefly to see if anybody has any questions, or if there's any of the Q&A that we might need to address before we move on to housekeeping. All right, Meredith, I'll let you take over.
Sorry, I couldn't get control of my screen back. Let me stop. There you go. Couldn't get off mute. So let me go back. Sorry. Okay, so a few housekeeping items. So what you should have completed by now is the patient safety and family-centered care environmental scan worksheet from last month, as well as completed your session evaluation so that we can get that CE credit out to you. This month, to do the environmental scan worksheet, I see there was a question in the chat on where you can find this. So I'm going to show you in a minute where you can get it. It's emailed to every participant at the beginning of the month, but I also post it to the website. So I'm going to show you where that is in 1 second. Also this month, after this session, please complete the session evaluation so that we can get you your CE credit. That should have come to your inbox this morning. And as I mentioned at the top of the hour, I apologize for the confusion. I wanted the evaluation to be in your inbox so that you had it ready to go, and not to make you feel like you missed the session. And so what's ahead? We have another coaching session next week where you can come and have your questions answered. And then we will dig into policies and procedures in December. Few reminders about CE credit. So CAPC for our pre-hospital providers, that will be awarded after the last session, so in March. But please, as you go along, complete those evaluations so that we have it. And then CNE is awarded on a rolling basis. So you can expect your certificate for the October session within the next 2 weeks or so. And for our physicians who are looking for maintenance and certification part 4, you must complete phase 2 and work with us through June of next year. So just a quick reminder on the focus area guides and environmental scan aspects. So this focus area guide is emailed to you, like I said, at the beginning of every month. The environmental scan worksheet is found right here where you can work through the process flow map. These questions are the same. Some more probing questions to help you think about this area in more depth. And then this is the example from the first focus area, but they're all the same. As well as jot down some suggested change strategies, what others are doing from around the country, maybe here in the breakout room. And then list maybe what you would do to improve here. So that would come March when we're ready to do our implementation project. So you can refer back to these and really understand kind of where your thinking process was 6-7 months ago when you were going through this focus area. All of the key drivers and change strategies that Lisa and Rachel talked about today are also in these focus area guides. They're listed towards the end, as well as the resources that Rachel just pointed to. And these are on the website as well. So that's one component. Now we ask you to complete sort of this online version of the environmental scan in our REDCap. And you have an individual link that gets emailed to you at the beginning of every month where you can go here, answer the yes/no questions from the process flow map, and then talk about your strengths, barriers, and what change strategy or driver that you might use to implement change in this area. So, while this isn't really required for CE credit, it's helpful to us for when we get to phase 2, that we can really understand at a collaborative wide level what your barriers are, what your strengths are, and what change strategies you're looking to implement so that we can really help coach you through some of these processes. A few other housekeeping items, session recordings, you can find them here. Our Facebook group, I encourage everyone to join the conversation. And then we're going to go into breakouts here in the next hour. I'm trying to wrap up a little bit early to give everyone 5 minutes or so of a break. But just a reminder of our culture in the breakout sessions. It's really a focus on all teach, all learn. So we want you to turn your cameras on and speak up. You'll be able to do all that in the breakouts. Support one another and really actively participate, ask questions, and really the reminder that, if we all collaborate, improvement, we can really drive improvement and to celebrate successes. So to get to the breakout rooms, there are several links. I think some of you ended up there at the beginning of the hour, and I will try to make that more clear in my calendar invite that first you come to this link for the main session, and then we go to breakout sessions and you'll go to your individual links. So these are hyperlinked on the agenda. We're going to dump them in the chat box here really quickly. And you can also get to them from the website. So let me go to our website real quick and show you all how to get to everything. So
Meredith, there's also a question about where exactly to find the evaluation.
Okay, so the evaluation came by email because it's specific to each one of you. So that for CE purposes, I know who completed it. So if you need your link to the evaluation, email me at PWDC@AMSCimprovement.center. Let me put that in the chat. Email me there and I can send you your link. So if you come to EMSCimprovement.center, that's our homepage. It's listed, it's linked in the bottom of all my emails that I send you. Or you can just Google EIC and it'll take you here. If you come to QI Collaboratives and you go down to PEC Workforce Development Collaborative, this is the main page. You can get to the calendar of events. You can get to the focus areas, and then you can click on them one for the month. So if I wanted to go to this month's equipment, supplies, and medication, click on it, and you can see the flow diagram, key drivers, change strategies. You can also download the entire thing as a PDF here, which is what you saw on my PowerPoint. And you can download just the environmental scan as a Word document so that you can type into it or you can write into it or change it however you'd like. Now your links to the REDCap are individual to you. So if you need those, you'll have to email me or dig back through your email. I know sometimes those are getting flagged as junk. So email me and I can try to get you those links. All of that can be found right here. So in about 5 minutes, we'll kick off the breakout sessions. In the meantime, I just wanted to remind you all this last chance to participate in a PEC research survey. And you know, what's really important here is that the PEC workforce across the country has not ever really been fully characterized. And so what we're trying to do, whenever EMSC Scholars is trying to do, is really understand the common challenges or resource needs that PECs across the country need, so that we can develop tools and strategies to help assist and help make you the most effective that you can be. So there's 2 different surveys. One's pre-hospital, one's hospital. You can follow these links if you have the slides already, or you can scan this QR code and get it done. So with that, you can go over to the breakout sessions, and we'll see you all there very shortly. Okay, and let me, while we're doing that, I'm going to drop the links to the breakout rooms in the chat.